Diabetes World Day. You know there's a problem when you have a world day for something. This is Dr. David Cruz with Whitecoat Medicine Talks, and I want to talk about diabetes today since it is November 14th and it is Diabetes World Day. So, being that there's so many issues with diabetes, it sometimes amazes me that people don't want to get treated for it. A lot of people think the medications are bad for you. You know what's bad for you? Diabetes is bad for you. Diabetes causes your arteries to harden, you to have strokes, you to have heart attacks, you to have poor vision, kidney failure, extremities cut off. So it affects your whole body. So when we're talking about diabetes, it's really taking a toll on your whole body. Okay, so I took off my glasses because of the reflection. However, we're talking about diabetes and why people don't like to take their medications sometimes. And they mention that they're afraid of the medications. And a lot of the side effects that the medications are, of course, they're very simple, very nausea, vomiting, abdominal pain, things of that sort that is easily treated, or we change the medication. Your doctor may look at what effects you're having and then change the medication. A lot of people self-medicate, and the problem with self-medication is that it's good that you're treating yourself. However, the problem is that sometimes there's cutoffs at where we can use the medication and where we can't use the medication. So people go to Mexico, buy medications, and they're taking those without realizing that maybe their kidneys are not working well and they can poison themselves. And that's even more dangerous than your doctor giving you the medications and checking your kidneys and checking your blood work as you go along. Now, I think that it's very important also to do everything possible to control your diabetes. Diet is very, very important. And of course, sometimes taking natural things that help your diabetes. We've talked about some of the natural things that will help your diabetes here. And you can go back and look at those videos as well. But talk to your doctor before you do anything natural. And if you are doing something natural, talk to your doctor and let them know that you're also drinking a tea or taking some other pills that may be helping your diabetes as well, because at that point sometimes it's very possible to decrease some of your other medications so that you're taking less medication. Once again, stating that medications are bad or that you're afraid of them or anything like that being your biggest concern, I think the biggest concern should be the diet and the exercise, because diabetes should be controlled with diet and with exercise. Now, when you are on a good diet and you are exercising, you're burning sugar, you're not eating the sugars or the grease or the fat that you're supposed to be avoiding anyway on your diet, and so that is more beneficial than anything else. So when people are afraid of medications, they should really be afraid of the things that they're eating, the things that they're drinking, the things that they're doing, and those are the modifications that you should be afraid of if you're not doing the right things. The medications counteract all that stuff, and they kind of help you so that we can kind of get things back to where they should be. That doesn't stop you from having to do the right things. You have to exercise, you have to diet. Even for people that can't ambulate, you still exercise in a chair if you can, or in bed, or whatever you have to do, you exercise, because exercise is very important. And making proper, good choices on your diet are very, very important as well. Now let's talk about the problems with diabetes. Sometimes, we always do a test for your vision. We always send you either to the eye doctor or we take a retinal scan and send it to an ophthalmologist, because diabetes will cause blood vessels to start forming in the back of the eye, cause a lot of changes, which can lead to blindness. And so it's very important. A lot of people go and they just get their glasses and they go, yep, I'm done. No, you need a very good test of the back of your eye to make sure that your retina is actually okay, because those are the issues that diabetics are going to have and need treated before they get to the point that they can cause blindness. We also are always checking your cholesterol level. And a lot of people don't want to be on cholesterol medication, but we have levels that we want diabetics to be at that are actually lower than other people. And the reason is because diabetics are more likely to get heart disease and cardiovascular disease and atherosclerosis, so hardening of the arteries, and strokes. And so we try to get that bad cholesterol as low as possible. And the LDL, which is the low density lipoprotein, we want down at a 70 or lower. So a lot of times people think, well, my cholesterol doesn't look too bad, it's 199, it's okay. But sometimes your LDL is what we're looking at, and we go, it's still above 70, we need to treat you and get that lower. And so we'll put you on medications for those things. So very, very important for the diabetic to be on that. We also talk about patients being on aspirin. And aspirin is important because it helps us to decrease the chances of you getting strokes and heart attacks. And we did a video before talking about whether you should or should not take aspirin, and it's very beneficial for those people that have a lot of medical problems because it will decrease your chances of heart attack or stroke. So those are important things to remember. What are some of the other important things for diabetics to have done with your doctor? An EKG is very important because we want to see how your heart is, and at some point you may even get a stress test to make sure that everything is going well. The other things that we will be looking at for you are your kidneys, and the kidneys are something that we follow closely, and we go through all the stages. There are 6 stages if you kind of rank them as far as how your kidneys are working. The first 2 stages are okay, and then we start getting into some kidney problems after that, and we talk about it continuously with the patients. What's important for your kidneys? Making sure your diabetes is under control, making sure your blood pressure is under control, and making sure you're eating the proper things. So a good diet for your kidneys, for whether you're diabetic or not, is eating more vegetables and less meats. And when I say meats, I don't just talk about red meat, I'm talking all kinds of meats. And so if you eat more veggies, that's more beneficial for you, and you'll do better as far as taking care of your kidneys. Now, when we talk about your extremities, and we always check the feet on diabetics. Why do we check the feet? Because we know that diabetes starts affecting your small blood vessels, and your small blood vessels kind of block off, and if they start blocking off, that means your nerves will start dying off also, and you start getting neuropathies or burning sensations to your feet. You can't feel your feet, you lose sensation. And so every year, every 6 months, we're doing these foot exams just to make sure that you have sensation throughout your foot. And it's very important for diabetics to be checking their feet because you can get ulcers. You can step on something without even feeling it, and then by the time you know, then it's already infected, it becomes an ulcer. And once you get ulcers on your feet, you have to lay off of your feet. It takes a lot of energy and money to take care of a foot ulcer, and they heal very, very slowly, and so it becomes very hard to deal with sometimes and very frustrating for the patients as well. So checking your feet every single day and staying on top of that, because a small little infection can get worse in one day and become a big infection to the point that there's an amputation or your bone gets infected and you need surgery. And so we have to stay on top of those things. So for diabetes, there's a lot to be concerned about, and there's a lot of reasons to get treated, and you want to make sure you're treating your diabetes as well as you can and stay on top of it. Don't be afraid of your medications, but if you do have problems with your medications, then talk to your doctor, and your doctor will more than likely change medications for you. If you have concerns about a certain medication because you've heard something, now that there's so many commercials about different things that lawyers put out, it scares people, and sometimes it's no reason to get scared over these things, but you do have to talk to your doctor because your doctor will stay on top of these things. We always have people coming in and talking to us about some of the side effects of the medications, and if there's any studies that show differently or what to be concerned about. with different medications, and we'll work with the patients. We don't want to just put patients on medicines and say that's what you have to be on and that's it. Your doctor will work with you, but definitely bring it up with your doctors, talk to them. We want your diabetes to be well controlled. We want you to be healthy and exercising and eating well, and if you can take care of your diabetes, that would be a big step in taking care of yourself. Now, this is Dr. David Cruz for Whitecoat Medicine Talks. It's good talking to you once again, and we'll be back with another video soon. Take care. Bye-bye.